Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. CARICOM has its first female Secretary General. This story takes the lead in a 1112th edition of Caribbean Perspective for Friday 14th May 2021. Details after this break.
Did you know that your friends and family can now shop at the Food Fair from anywhere in the world and you can receive here in Grenada? The Food Fair and GrenadaMarket.com now make it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
Welcome back. Dr. Carla Natalie Barnett was confirmed as the 8th CARICOM Secretary General during a virtual special session by heads of government of the Caribbean Community CARICOM on Tuesday last. Barnett, a national of Belize, is the first woman and the first Belizean to be selected for the post. She will replace Ambassador Erwin Larocque, who is completing his second term and will assume office on August 15th, 2021. Heads of government, in congratulating Barnett on her selection, recognized the historic moment for the community. A former Deputy Secretary General of CARICOM, Barnett was also a Vice President of the Belize Senate and served in various ministerial capacities in her country's government. She was Financial Secretary of Belize and Deputy Governor of the Central Bank of Belize, as well as Vice President Operations of the Caribbean Development Bank, the CDB. Barnett attained her PhD in Social Sciences from the University of the West Indies, Mona campus in Jamaica. She also holds a Master's of Science degree in Economics from the University of Western Ontario in Canada and a Bachelor of Science degree in Economics from the University of the West Indies. In other news, Prime Minister Dr. Keith Rowley of Trinidad and Tobago has described managing the COVID-19 pandemic as a consistent decision-making process. He was speaking on state-owned TTT Wednesday morning, where he touched on various topics including the borders, herd immunity and the opposition. TV6's Anselm Gibbs reports.
We could always have done better, but we could easily have done a whole lot worse.
Prime Minister Rowley speaking on state TV on Wednesday about how TNT has been handling the COVID-19 pandemic so far. He responded to criticism from the opposition about him urging people to visit Tobago for Easter and the current surge in cases.
In trying to explain our circumstance and dodge our responsibility, you're being told what happened is because the Prime Minister said come to Tobago. What about all the other things the Prime Minister say? For a year, the Prime Minister has been saying certain things that are contributory to our good outcome. So he wasn't listening to the Prime Minister then.
Dr. Rowley agrees with the Health Minister that it could take 6 to 7 months to achieve herd immunity with vaccinations, depending on public confidence in vaccines and the availability of vaccines.
It was a Sinopharm a few days ago, and we were in the line, having accepted a gift of 100,000 doses, and we have an order for purchase of a larger amount. And of course, we have with Pfizer conversations that as soon as they are able to deal with people like us, we are in the line to purchase from them, that we come back. And hopefully the other ones that have been certified, like Moderna, in recent times, that we access their supply. That is as chaotic as the supply line is.
The Prime Minister says with the recent spike in cases, there are no plans to completely reopen TNT's borders anytime soon.
We were just about to begin to consider opening up a bit more because people were being vaccinated in North America in a major way. And we here had begun to vaccinate, and we could have been able to bring more people in.
Dr. Rowley describes guiding the country at this time as a consistent decision-making process. Anselm Gibbs, TV6 News.
11 additional COVID-19 deaths have pushed Trinidad and Tobago's death toll for the month of May to 66, with only 13 days gone in the month so far. More in this TTT news item.
The Ministry of Health is also reporting 615 new COVID-19 positive cases. Among the deaths are 3 elderly males, 3 elderly females, 2 middle-aged females, and 1 middle-aged female, all with comorbidities, as well as 1 middle-aged female and 1 adult female without comorbidities. According to the latest update, the 615 positive cases reported today, Wednesday, reflects samples taken during a 5-day period, May 7th to May 11th, and not the last 24 hours. Total active COVID-19 cases now stand at 4,588, with 343 patients at hospital. The Ministry of Health says it should be underscored that the cases tested reflected a positivity rate in excess of 40%, which is a cause for significant concern. As such, the population is urged to follow all the personal health guidelines to avoid becoming infected or spreading the virus.
You're listening to Caribbean Perspective with Eddie Frederick.
Although occupancy levels have decreased in facilities which house COVID-19 patients, epidemiologist Dr. Avery Hines is still urging the public to follow the COVID-19 health measures. TTT's Kimberly D'Souza has more in this report.
Occupancy levels in the ambulatory ward have decreased to 41%, but the country is not out of the woods just yet. Epidemiologist Dr. Avery Hines shared the figures during Wednesday's COVID-19 health update, adding that the high dependency unit has a capacity of 93%, while the intensive care unit has a capacity of 74%.
The decrease in the occupancy is really because of the increase in the total number of beds being counted. We still want to emphasize that as new cases are being diagnosed, these people are ill, they continue to need hospital care, and that this is an interim step, but it's not a be-all and end-all solution to the occupancy concern.
Dr. Hines said over the past few days, an additional 130 beds have been added to the parallel healthcare system. One of these facilities is UTT's Valsain campus, which has been converted to a 4th-level step-down facility. Meanwhile, General Manager of the North Central Regional Health Authority, Dr. Abdul Hamid, said the purpose of the facility is to reduce the capacity of the parallel healthcare system and to decant patients from major COVID-19 facilities.
This facility includes 40 beds with pure oxygen tanks for each respective beds. 32 patients currently quarantined at the facility, and it's expected to reach 40 patients by midday, with an anticipated 15 discharges to home.
He said there is medical equipment, including crash carts, resuscitation equipment, and medical supplies.
Patients will be discharged from the hospitals with mild to moderate symptoms. Oxygen requirements 5 liters per minute. So in concept, this is an oxygen therapy step-down unit. Ambulatory care level 5, which means that the patient can do most things for themselves with minimal input. Minor acuity care level 4.
He said patients usually stay at the facility for approximately 3 days, adding that the facility also houses pharmaceutical supplies to prevent patients from going to pharmacies. Dr. Hamid said a similar facility will be available at Point Fortin. To aid in this country's occupancy levels, the U.S. government has donated 2 field hospitals with a capacity of 40 beds each. Epidemiologist Dr. Avery Hines said they can offer both ICU and HDU support services. While they are not yet operationalized, they will be used on an as-needed basis. Kimberly D'Souza, TTT News.
The Pan American Health Organization, PAHO, has highlighted the situation in Guyana as worrying in its latest report on the impact of the pandemic on the Americas. Gordon Mosley of News Source Guyana has that story.
According to PAHO, while the number of cases are falling in Brazil, Guyana and Bolivia, which border Brazil, are both experiencing a surge in new cases. The organization has noted that it is important for persons to get vaccinated so that the countries in the Americas could reach herd immunity. Guyana currently has more than 1,700 active cases of COVID-19, with the infection rate increasing steadily. Since the start of this month, more than 1,200 new cases have been recorded in 11 days, with 32 deaths reported in the same period. It is suspected that a faster spreading strain of the virus has made its way into Guyana. With the World Health Organization reporting last week that there is growing evidence that the virus is airborne, Guyana's Minister of Health, Dr. Frank Anthony, today advised that persons should keep those masks on in indoor places outside of their homes.
So there have been a long discussion pertaining to aerosols and its role in the current infection. And I think more and more the reputable international agencies that deals with epidemics have concluded that aerosols play a very significant role in transmission, especially in indoor environments. And so we too have to take the new evidence into consideration, and we have to keep warning people that if you are working in an indoor environment, then it's necessary for you to keep your mask on all the time, because you don't know who you're interfacing with, and you don't know what is circulating in that indoor environment's air.
And in relation to vaccinations in the country, the health minister revealed that more young people have been turning up to get vaccinated, and he's pleased about that. He said the government will continue to push its vaccination drive.
We continue these partnerships, and we would like to see more of them happening, especially in Region 10, because Region 10 still, when we look at our numbers, they're still lagging behind in terms of vaccinations. So that's one area that we want to encourage groups in Region 10, community-minded citizens, influential people who can talk to others to make sure that people take their vaccines. That is a very important part of the response. So we really want to appeal to those persons to assist us.
The ministry is also encouraging citizens to pay attention to the date for the second dose of their vaccine and ensure they return to their vaccination center for that second dose so that they could be fully immunized against COVID-19.
Hubbard's big promotion is back. Live free for 1 year. Spend $50 or more in any Hubbard's department and receive a chance to win big prizes every month. Property or vehicle insurance for 1 year. Free internet, cable and data for 1 year. Free fuel for 1 year. Free cooking gas for 1 year. Free electricity for 1 year. Free drinks for 1 year. Extra cash account and the big free groceries for 1 year. Promotion runs from April 1st to September 30th, 2021. Live free for 1 year with Hubbard's in association with Solgas, Flow, Grenadian General Insurance, Carib Brewery, Coca-Cola, Grenada Bottling Company, Grenlec, Communal Cooperative Credit Union, Dutch Lady Milk, Promo, Danny and Supreme. Terms and conditions apply.
I am Eddie Frederick, wishing you a restful weekend. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.